Good afternoon. Welcome to another episode of The Mind Game. We're going to start things off as usual with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Welcome. I have a special guest in the house today. As usual, to me, they're all special. We have Mr. Craig Ulmer. He's the CEO of Community Health Net, a local nonprofit, am I correct?
Correct.
Healthcare organization here located on 12th and State.
That is our main location.
Main location, or you'll have other locations.
Oh, yes.
Let's get right into it. Brief introduction.
Well, my name's Craig Ulmer. I've been CEO at Community Health Net for a little bit about a year.
Okay.
And prior to that, I was interim, but I've been with the organization for 27 years.
Okay.
27 years.
Okay. So you are homegrown. You're local.
Yes. Yes.
Okay. Educational background. I mean, what brought you to Community Health Net?
Well, Community Health Net, I started there back in 92.
When they had first opened, because they ain't
Well, Community Health Net started at the community centers.
right with Tony Snow.
Yes,
Okay.
at the
Dr.
JFK,
Snow, right.
we had a site.
Oh, you were there then?
Yes.
And Bobby was still there.
Yes.
Okay.
Yes.
Okay. See, I didn't know any of that. And what is your background in? Are you a doctor? What, I mean, what,
Well, my
business?
background is in IT,
Okay.
and I do have some healthcare background, but
Okay.
primarily in IT.
Okay. And so you just worked your way up through the ranks.
Yes.
Okay. And you interned under Dr. Snow.
Well, Dr. Snow, he was our primary physician out at the JFK
JFK,
Center,
okay.
and I worked in the IT department. We had just started computers there at the John F.
Okay.
Kennedy Center,
Okay.
and that's when I joined the network.
So what is Community Health Net? Let's just let the people know what is Community Health Net.
Community Health Net, we are a primary care office.
Okay.
We provide medical services, dental services, we have vision services, and then we have some special program services there also.
Okay, at that location, you mentioned other locations. Where are the locations at?
Well, we have a medical office out in Harbor Creek, which
Okay.
is 4401 Iroquois Avenue.
Okay.
And that's right pretty much next to the Iroquois High School, right across the bridge there.
Okay.
And we have a dental location in the John Horan Garden Apartments.
Oh, really?
on
I didn't
10th
know that.
Street. Yes, we have.
Okay.
That office actually is one of our busiest offices.
Okay.
It's a dental practice. We have a Dr. Hammerly.
Okay.
He's out there, and we see a lot of children out there in that complex.
I know in the schools, I work at one of the schools. Actually, I work with your wife,
Yes.
Miss
PD.
Kelly. Yeah, Pfeiffer Burley. And we see a lot of those kids come through. What type of, is this low income, medical insurance? What type of population are y'all serving?
Well, primarily our census is the majority of Medicaid.
Okay.
We have a little bit over 66% Medicaid, but we do see patients with any insurance,
Okay.
and also patients who do not have insurance.
Okay.
So whether you have insurance or not, Community Health Net would be there to provide the care for you.
And are y'all obligated by any state law or anything, or that's just what y'all do?
That's pretty much what we do. We do receive some grant funding that will allow us to provide services for self-pay. People who do not have insurance whatsoever and are on our sliding fee.
Okay.
And that sliding fee is based on your family size and your income. And the amounts that we slide down, we have a grant from the federal government that allows us to take care of those patients as well.
Okay. And this, the age category, what's the ages that y'all serve?
We see pediatrics, babies, all the way up to the elderly,
Okay.
all the way through.
So it's a wide range. Y'all run the full gamut
Correct.
of people, what y'all seeing. Okay. Over the years, y'all have grown. What's your census? How many of y'all serve a year?
Well, as far as active patients, we have about 20,000 active patients.
Okay.
And as far as encounters in a year, we have about 44,000
Okay.
encounters in a year.
That y'all come through the door and y'all treat.
Correct.
Okay. Do y'all provide any pharmaceutical services or anything like that?
Yes, and those are some of the other services that we have. We
Let's
do
talk
have
about that.
we have what we call a 340B pharmacy, and having a 340B designation allows us to offer name brand drugs and also generic medications at discounted rates. And if you're on a sliding fee scale, that also can be slid based on that sliding fee scale.
Okay, so that would apply to that.
Correct.
Okay. Aspirations as far as expansion and growth. I know you said y'all got some other locations. Do y'all plan to expand in the future, the upcoming years? What's going on?
Yes, we have an aggressive strategic plan that we are currently in. We're at the beginning of it.
Okay.
And we do have some growth in the region lined up there also.
Okay. Now, is this just it's a nonprofit, am I correct?
Correct.
Do y'all have any other partners associated with this, or is the center still involved? I mean,
well, we collaborate with a lot of other organizations in the city.
Okay.
A lot of healthcare, behavioral health care organizations in the city. But as far as having an active relationship with the centers that we basically grew up from, we really don't.
Are you looking to enhance that in the future?
And that's part of our strategic plan. We need to get more, I'd say, back into the community the way we started.
Exactly.
And those are a lot of the initiatives that we have on the books for us.
I know when I was a kid, I mean, Bobby Harrison, one of the true leaders and pioneers as far as minorities in this community is concerned, opened up that downstairs in the JFK. And then Dr. Snow came, and he was basically all our primary care physician, all the families that lived out there was under Dr. Snow. And then they moved, well, he went to the community health, and then I left and came back. But since I came back, I've seen the growth that the community health net is providing for the community. It's a wonderful thing. Y'all doing good work down there.
Yes, and at the centers, I mean, we were at MLK and Booker T, and they all decided, let's come together and really provide the care that the community needs. And that's how Community Health Net was formed, coming from all the three centers coming together.
There was a dentist down there, I think his name was Jacinto. He was at the Erie one. He was a young guy I went to school with, but when I left Erie, he was practicing dentistry down at the Booker T. Washington Center. So I take it that this is something that you've worked for and looked forward to doing throughout your career, and now you're the top guy down there?
Well, actually, I was pretty comfortable in the IT department, just doing my reports, and cause we have, of course, a lot of reports to do for the government, and just internally a lot of reports. And then as the need developed, I was promoted and moved up through the organization to the position that I'm in now.
Which leads me right on into a topic that some people are sensitive and shy away from, but I have no reason to do that. And I'm sure you're aware of the much ballyhoo or whatever you want to call it that has been made about the blacks in the community as far as not being able to advance and have to go to Charlotte or Atlanta or somewhere to really make a name for themselves or just to earn a decent living, when we have somebody sitting right here who was homegrown, found a niche, and worked his way up. What is your thoughts on that?
Well, I think as Erie itself grows, as the community grows, I think positions in those areas will become available, and I should say more available to us all.
Now, do y'all do one of the things that I like to put out there when they talk about the opportunities for the blacks, and particularly the blacks, because you have other minorities here in this city that aren't getting the opportunities as well. But for the blacks in general, the young blacks, what would you say to them as far as wanting to stay here and earn a decent living in the community that they grew up in and want to provide for their family?
Education.
Education,
definitely. Stay in school and get as much of their education as they can, and then apply that somewhere. And be true to that education when they apply.
You know, a lot's being said and being made of that, but when it comes down to any situation that I've ever encountered in my life, when you look at it from a simple standpoint, it really is just that simple. You know, the opportunity will present itself, I think, not just for blacks, but for anybody, but blacks in particular, more importantly, in this community when you have the credentials to back that up, you know,
Right.
and then the talent pool will grow, and you'll be able to choose the minorities to put in those positions if they are qualified and
Correct.
want those jobs. Have y'all decided to do anything as far as the recruiting of the doctors on y'all staff and stuff like that?
Oh yes, we have an ongoing recruiting initiative there at the organization, at the physician and dentist and mid-level, at that level, but also at some of the other levels within the organization, like medical assistants. We hire many medical assistants. Some of them stay because they truly, well, if I put it like this, nursing and being a medical assistant really used to be a calling or considered a calling.
Okay.
And somehow we got away from that and it just became a job. And now we're seeing a lot more of the candidates coming in for applications that have that. It's hard to say, put your finger on it, but they have it as more of a calling, and they really have that dedication to the patients and to the community. And those are the people that we really are looking for, really want to hire.
Well, it goes without saying, Mr. Ulmer, you know, if somebody really wants to do something and they choose that particular career path to go down, they're going to be more successful than somebody just looking for a job. And like you said, those are the type of people that y'all looking for. My mother always told me, if you can't do what you like, and then you better find something like what you do. Okay, and I find that to be more pertinent in today's society because, like you said, there's not a lot of people that say, okay, well, I truly want to be this, say a nurse's assistant or medical records individual, and they pursue that career path. So let's talk about, do y'all have any like entry-level positions as far as, what do y'all have down there as far as nursing assistants, CNAs, do y'all do anything like that?
Well, we do use a lot of LPNs and medical assistants. We are always looking for those two positions. We do have an active recruitment initiative for doctors and dentists and our CRNPs, hygienists for dental side, yeah.
Well, you know, I think that the initiative should be, emphasis should be put on the initiative to recruit the people that are looking for those entry-level positions, such as an LPN, and can go back to school while they work to become an RN and then a BSN and so on and so forth. But, you know, just getting the word out, in particular here in the community where you see a lot of the young ladies, they're doing the home health, and that's where it is at. You know, they don't go forward to do, and even the gentlemen don't go forward to do any aspiration work as far as being an RN or a nurse practitioner or anything like that. Are y'all taking any initiatives to reach out into the community, and particularly the Black community?
As far as education and training, we really aren't on that end of the spectrum. But just reaching out into our community for qualified people, oh yes, that's an active everyday thing. Which
is good, because a lot of times you hear people talk about, even now when the economy is supposed to be booming, you hear people talk about, oh, well, I can't find a job. And when it comes down to it, I think me and you both know they're not looking. Because you can come in and you're proof of that. You came in one area and worked your way up from literally the bottom to where you're at today, which is a CEO. And a lot of companies nowadays are looking for people just like that. They want to come in and learn about a company as much as they can and go through the ranks and go as far as they can go. Do you have any other aspirations as far as healthcare or running a business?
Well, I really enjoy what I do now at Community Health Net. I've enjoyed what I have done in there, but even more so now.
Is it a combination or just CEO work? Do you dip into the IT department where you were born?
I try not to. I try not to. We have a great staff, and I try to let them, some of them are new, and I try to let them find their own way.
Have you had any active involvement from people that were associated with the Community Health Net prior?
Oh yes, we've had recently, within the last year, we've had a number of providers
Okay.
come back to the organization. Some of them got their start as a new grad at Community Health Net, moved on to some of the larger hospital systems, and are now coming back to Community Health Net.
Okay.
And I said that's where their heart was.
Okay.
And they're coming back to the organization.
Well, it goes without saying that y'all do real rewarding work. Any upcoming events?
Let's see, none really. No real upcoming events coming anytime soon.
Okay.
We always have our yearly patient appreciation picnic,
Okay.
which is a big deal.
Okay. Okay.
And that's the second weekend or second Friday in August.
Okay.
That we always have. And we have just come off of our sock drive for the homeless program.
Oh, really? Tell us about that.
What we do every year, every fall, we do a drive where we collect socks.
Okay.
And our homeless department, their team, goes out and distributes those socks to the shelters.
Okay.
And like the upper room, and
Okay.
they distribute
right
those
there.
to the homeless. And we also have had a blanket drive,
Okay.
which was new to us. And that turned out really well, because what our pediatrician was finding was a lot of our patients would come in with their children and would not have adequate covering for those children during the winter months. And so she saw that need, and she said, "Hey, we need to do something about it."
Okay.
So we said, "Hey, let's go ahead and do a
And
blanket drive."
who was the beneficiaries of the blankets?
Those are our patients who come in, and if there is a need for them to have a blanket for their
Okay.
baby, and that's what she basically collected. They were the baby blankets.
Newborns. Okay.
And the kind you just kind of throw over your stroller, or put those in, and we do those. And whoever comes in and says, they need it, or she identifies that you really need something heavier on the baby,
Okay.
and we'll give them those blankets.
Well, that's a beautiful thing to know, because it signifies that you're working with and around people that care about the people that they're serving. And when you're doing the type of work in the community that y'all doing, but more importantly, serving the people that y'all serving, which is the less fortunate. Any little invitation that y'all can give is greatly appreciated, and particularly the socks. You see so many of the kids. I know over at the school they have the coats and the hat drives and glove drives, and people bring all kind of stuff, and there's just a need for that here in the community. Community Health Net, how financial stable are they?
Well, we are now, I can say we're very stable.
Okay.
We have a great financial team there, and they're phenomenal. It's one of the few things that I don't have to worry about with the team there that we have now.
So y'all will be there.
Oh yes,
On Tarleton State.
definitely.
Okay. What do you think that your calling was to even bring you to the JFK Center? Did you have any, like you said, desires to do healthcare when you were younger? That just
Well, it wasn't really the healthcare piece that brought me there. It was more of the
IT?
interest in IT, and
Okay.
and back in the olden days,
That's true.
It was a big deal to have a computer on your desk.
Okay.
And,
Yeah.
and
20-some years. Yeah.
Yeah,
Especially at the JFK when they were, they were growing, but they were putting things together as they went. So I can imagine that was kind of big. Was that your first love?
I'd say
Pretty
yes.
much, yeah.
I'd say yes.
Yeah. And as far as what y'all have down there at the Community Health Net, is it adequate? Are y'all updating on a continual basis, or what are y'all doing as far as IT?
IT, we're definitely growing and expanding there. We're moving a lot to the cloud.
Okay.
We have a great EHR that has our electronic dental, electronic medical system. We have a great system there.
Okay, so everything is moving in the right direction
We'd say
as
yes.
far as that. What made you want to make this your home? I know with the IT background, in particular, a minority in the IT, because you don't see that many blacks in IT departments. You can go all over the country, and you got them here and there. But what made you want to stay here?
Family.
Family?
My family, yeah,
Okay.
definitely. Of course, I had moved away and gone to school and came back, 'cause this is where family was. This is home.
And that's what brought you back to Erie. A lot of people make a lot of things and raise a lot of issues and concerns about moving back to Erie. And the people that I've met that came back, such as myself, that was the number one thing. Especially if you was born and raised here. It was just something about growing up here in Erie in the 60s and 70s and the 80s that it was a very close-knit black community here, and everybody knew everybody. Okay, and going forward in your life, you always want to come back to somewhere where you're comfortable.
Comfortable, right.
You know. What about you? Family?
Well, yes, as you know, you work with my wife.
Yes, okay.
I have 2 children.
Okay.
They go to school here, and they're 14 and 16 in that teenage years.
Okay. And that's a challenge all in itself.
Oh, yeah.
You know, I can understand that. As far as the expansion down there, community health, that you touched on behavioral health. What services do you offer for behavioral health?
Well, that's one of our new services that we're in the process of
putting
shaping together.
Okay.
As I mentioned, some of the existing services that we've had for years, like the dental and the medical and the vision, those were pretty stable. And a lot of the standalone sites, as I mentioned, the Harbor Creek location and the John Horan out there on Franklin Avenue, that one. But we also have the dental at 1611 Peach Street.
Okay.
And also 2922 on the Stairways campus. We have a dental office there.
And where's that 2922?
Right across from Collegiate. It's pretty much at 30th and State.
Okay.
Right there.
And what services are you offering up there?
Dental.
Dental
also. And we have a far west side. Far west side, out there in Girard. We have a school-based health center out there in Girard.
And what is that serving?
And that is serving medical, and it serves the community, anyone who wants to come in for primary care services.
Okay, not just school.
Correct.
Okay, so this is for the community out in Girard, the Girard community.
Correct.
Are y'all growing out there?
And that's one where we're adding a part-time provider out there.
Really? So there is a need there?
There is a need there, yes.
Okay. So far as your dental, what type of services is your dental offering? Are they offering workup, any teeth pulling, root canals? What's the extent of it?
It's basically routine preventative care.
Okay.
We do extractions, but a lot of our focus is on the prevention side of things, where we're trying to get the younger, getting children in. We have some mobile equipment, portable equipment. Okay. And we're trying to get to some of the schools and let the kids know, if you take care of your teeth now, while you're small, you're young, you can save them, and you can have them till you're older.
Now I know they do have the mobile dentists coming into the schools here in your school district. Are y'all affiliated with any of that stuff?
Now, not with the mobile dentists. We have some portable equipment that we have a location that the Housing Authority has set aside for us out in the Harbor Homes, where we can set up there. We've also done some work out in Girard at the high school out there.
How often do y'all set up out in the Harbor Homes?
And that depends on the need. Our goal was to have it there once quarterly, but it's based on the need, and we started it in the late summer, and of course we hit the winter here in Erie. So, so
how did y'all do in the summer?
It went rather well.
Okay, and so you're looking at to do that again this summer?
Oh yes.
Okay, so hopefully in the future, do y'all have any goals as to moving back into the centers, or just have everything there, or on a limited basis?
Well, we do want to get back out into the community, whether it's going to be directly in one of the centers or in the areas. But that's one of our goals, is to get back out into our community.
Just something mobile, or just or a building, or
that's yet to be determined.
That's yet to be determined. Okay, we'll go for that. We'll go for that. Now, as far as the community in the overall, I think that an organization such as Community Health Net is needed, but more importantly, have you been receptive into the community as far as the public and private sector? I know y'all serve a certain area, a demographic and population type, but as far as the private sector, have they stepped up and decided to, contribute to y'all's success?
Well, we have pretty much been since I've been in the CEO position, but I found out the best kept secret in Erie.
Yeah, it is.
A lot of people don't know what Community Health Net actually does and the services that we provide. So we are embarking upon an aggressive, as I mentioned, our strategic plan. We're rolling out an RFP for new marketing. To tell the community, this is what we have available to you, and all they have to do is just come there. It doesn't matter how much they make, it doesn't matter their income, family size, we're there for them.
you know, you drive by 12th Street and you see that sign that says Community Health Net right on the corner. So from what you're saying is that everybody in town, if they ever come into the downtown area, they saw that sign, but they
Right.
still don't know what y'all offering. And so y'all trying to get aggressive to let the community know, because y'all already are serving a large population of people, like I said, in search of in certain financial situations, but y'all trying to expand your base to let everybody know that it is for the whole community.
Correct.
As well. Okay, well, I get that. You know, and sometimes that's kind of hard to do when people don't know about you.
Exactly.
You know, I work at the community of caring on the weekends, and that's been there since 1980, and it's still people don't know where that's at. And y'all got a building 10 to 20 times the size of the community of caring, and it sits right there in the center of town. So if there was anything going forward that you would like to let the people know, what would it be?
That Community Health Net is here, will be here, and we're there for them. Some of the quality measures that we have to abide by are a lot stricter than just an average doctor's office or an average dentist's office.
And y'all are nonprofit?
That is correct.
Okay, okay. Final thoughts?
Well, just basically to let everyone know that we're there and we'll be there.
Okay. You know, for people who don't have any insurance, you know, healthcare in this country obviously is a large, enormous topic right now, especially with Obamacare and them trying to make the changes that they're making. The Community Health Net can be an alternative.
Correct.
Okay, for people who are going through that level in Obamacare that's too much for them. Okay, and the active recruiting that you're talking about can only help both the public, the immediate area, but Community Health Net grow as well. Okay, so I'm hoping that people out there listening understand what you're saying, and the message that you're trying to give them is that it's just not for a certain population of individuals.
Correct.
Community Health Net is for the whole community.
Correct.
And that's why it's called Community Health Net. And I think once y'all get out there and start rolling this stuff out, you're gonna see people coming from all walks of life, because insurance is a big thing for people, single and families.
Correct.
Okay, so hopefully they'll get this message out, they'll tune in and keep listening to my show and enjoy this show. And at this time, I just want to say thank you, Mr. Ulmer.
Thank you.
Once you start to grow, maybe we'll have you come back in the summertime when y'all had a picnic.
That'll be great.
And talk a little bit about that and say what's going on. I want to say to everybody out there listening and enjoying this, the pleasure's been all mine. And once again, hopefully I'll have you back on the show in the future. I'll see you again.